I grew up on a farm in northwestern Minnesota. Everything I did was rural. Went into family practice. Something started to bother me because I became aware that the success rate on treatment of our rural practices, our rural patients, did not look as good as it did for the urban. What could we do to improve rural care? There must be something to do. We had wonderful courses, but they were taking care of that much of emergency medicine, and it's that big of a field. We slowly put together a real elementary course, comprehensive advanced life support. We would train not only the docs, but the nurses and the PAs, and we would encourage other people from the rural hospital to come to our class.
Such a huge thing with CALS is that team approach. Our scenarios start with medics and start out in the field and then brings them into the ED.
Darrell had a unique vision for use of education in a different way, and it all started at his local hospital in Granite Falls, Minnesota.
We became a CALS hospital in 2008, and I remember Dr. Darrell really facilitating our CALS philosophy of teamwork training.
But he took it a step further. He also went to our ambulance and nursing staff meetings, and often they were joint meetings. Our teams in those critical care situations changed from a hectic, chaotic environment to a more relaxed, cohesive team.
We started to be very aware that our patients were doing better, and we were having more and more patients survive.
Dr. Darrell is my medical director in Granite Falls, and since the day I met him, he exemplified dedication to the rural hospital and rural stabilization right there, and through CALS expanded that to the rest of the state.
Dr. Carter's impact on rural emergency care in Minnesota is immeasurable. Nearly all of our 125 designated trauma hospitals rely on CALS and its trauma module to meet their training requirements. Over time, the CALS program expanded into other states and even internationally as others learned about the uniqueness of the education. Darrell's vision has impacted thousands and thousands of healthcare professionals in rural settings.
It's a real honor to be named the Rural Health Educator of the Year